Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. Now, I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. But with that being said, let's get into our questions for today. So, we've been on our antibiotic series. Now we are in the GI section. So, let's get into those questions. Question number 1 states the nurse practitioner has diagnosed the patient with H. pylori and is planning to treat with triple therapy. What is the best treatment option? Is it A, ciprofloxacin, azithromycin, and omeprazole? Is it B, clarithromycin, amoxicillin, and omeprazole? C, levofloxacin, flagyl, and amoxicillin? Or D, augmentin, flagyl, and doxy? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you are answering what is even asking of you. And I know y'all hear me say this over and over and over, and I'm gonna get on my soapbox really quickly, but I'm telling you these things because this is eliminating you making careless mistakes. So, yes, it seems like, okay, to do this. But when it's crunch time, when it's time to sit for boards, you have so many things on your mind for all of the things that you're retaining, all of the things you're trying to process through the questions, and then your anxiety and nerves are kicking in because this is your certification exam. But with that, you can find yourself skipping things, skimming over keywords, and missing things that you already know the answer to. And what we're not trying to do is get in here and miss points on things that we know. So I tell you these things, and it sounds redundant probably, and you're probably rolling your eyes when I say this over and over. And I know y'all know to do this, but I am conditioning you and preparing and strengthening that muscle memory so that what you do in practice, when it's game time, you can perform and execute to the level that you really are at, and you're not making careless mistakes. So we're doing this so that it becomes second nature, and you just naturally do it when you're under pressure. Okay. So again, the stem of the question states, what is the best treatment option, right? And I always tell y'all, if it's asking for a treatment, you need to run it back and see if they have provided you with a diagnosis. And in these scenarios, I give y'all a lot of times when I'm trying to build your knowledge on something, straightforward question, so it may seem easy level, but it's to ingrain and build that foundation. So I want you to take these steps on boards too. So even in a more detailed question, it's going to help you significantly. And I say this not just because I'm just talking. When I do my one-on-one sessions, trust me, my reviewers will even tell you this. The way it shifts, even on their practice question scores, before implementing these is significant because you're navigating through and trying to process and filter things, and you don't realize how many little things that you're missing out on. But when you start to force yourself to take these steps, there's a significant difference, and it's a decrease in careless mistakes. So again, you want to look and see if they have provided you with a diagnosis. If they have not, you're going to take it back a step further and look at those assessment findings to determine what the diagnosis is, because we got to know what it is to provide some type of treatment, right? Or if not, you're going to continue to do steps, assessments, and evaluations to gain so you can confirm a diagnosis. So here they have provided it to us. We know it's H. pylori. They have even gave us an additional tip that they're utilizing triple therapy. Because remember, with H. pylori, you can treat with triple therapy or quadruple therapy. So here we're doing triple therapy. So your best answer is B, clarithromycin, amoxicillin, and omeprazole. Now, Brittany's Brilliance, I like to say, I call my little mnemonics Brittany's Brilliance. I say when we utilize triple therapy for H. pylori, think of CAP, 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 C for clarithromycin, A for amoxicillin, P for PPI, because you can utilize any PPIs, PPIs, and then Prozol. Here we're using omeprazole, but think of like pantoprazole. Any of the Prozols are for that's the drug class PPIs, because think about what we're doing here. With H. pylori, there are bacteria, right? There's noted bacteria. We are giving antibiotics on a broad spectrum and to eliminate those gram-negative rods, right? But you also have the PPI to restore and heal the gut, because there can be secondary gastritis, etc. So again, think of CAP, clarithromycin, amoxicillin, and a PPI. B is your best answer. All right, question number 2. The nurse practitioner has diagnosed the patient with uncomplicated H. pylori. As there is a high resistance to clarithromycin, the nurse practitioner plans to treat with quadruple therapy. What is the best option? Is it A, amoxicillin, clarithromycin, Bactrim, and Flagyl? Is it B, Bactrim, augmentin, doxy, or Flagyl? C, is it bismuth, omeprazole, doxy, and Flagyl? Or D, Cipro, bismuth, omeprazole, and amoxicillin? Take a moment and tell me what you got, you guys. All right, so here the step of the question is, what is the best option? So what are we providing options to, So still here, we're talking about treatment because the patient has come in and they have been diagnosed with uncomplicated H. pylori. With this, they are, and of course, just like with anything else, we treat based off of the severity. So it's uncomplicated. So of course we'll do symptomatic management, and they are telling us here that you want to provide quadruple therapy. So we know we're going to utilize our antibiotic quadruple therapy, but there's a key here that lets you know that there's a high resistance to clarithromycin, and this is one of the really truthfully determining factors of why we go triple therapy versus quadruple therapy, right? And so with that, now just sidebar, I know in practice we do our own thing. So sometimes in practice, providers will just go with their preference. But for boards, for testing purposes, for we do textbook, it's a perfect world, right? When we're testing for boards, you need to know if they're telling you there's a high resistance to clarithromycin, then you're not going to give clarithromycin, right? Which is that triple therapy. Remember, I just told y'all about CAP. And just like we do anything else, when that sheet comes back, that information comes back, after, for example, like how you do cultures and sensitivities, well, with EEGs, and they are taking biopsies and etc. to test and determine and diagnose H. pylori, we will see things that is sensitive and resistant to. Okay. So if it's resistant to clarithromycin, again, we're not giving clarithromycin, right? So therefore, you want to go with the quadruple therapy. Now, quadruple therapy will be C. We're going to give you a bismuth. You want to give a PPI. You want to give a tetracycline. And you want to do your Flagyl, aka metronidazole, okay? So C is your best answer. All right, and lastly, question number 3. The nurse practitioner has diagnosed the patient with diverticulitis. The nurse practitioner is planning antibiotic management. All of the following are treatment options except. Is it A, Flagyl and ciprofloxacin? Is it B, augmentin? Is it C, metronidazole and Bactrim? Or is it D, clarithromycin? Take a moment and tell me what you got, you guys. Tell me what you got. All right, so here, step of the question states, the nurse practitioner is planning antibiotic management. All of the following are treatment options except. So remember, the key word here is except. We're looking for what is incorrect. So 3 of these answer choices will be treatment options, and 1 will be the incorrect one, right? Still, we're looking for treatment, so you want to look and see if they provided you with a diagnosis. They have. They let us know that the diagnosis is diverticulitis. Sidebar, because I get questions on diverticulitis so much. Diverticulitis, we have left lower quadrant pain. And again, like I was talking about in the last question, that we treat based on the severity, right? So with diverticulitis, we will always do our symptomatic management. You initially start off with clear liquids, but after 24 to 48 hours afterwards with treatment on board, they usually can tolerate some food. So you want to start with a low fiber diet and assess their pain and see what they can tolerate orally. That's when the low fiber is implemented. Now, for people with a history of diverticulitis who is not in an acute exacerbation or flare, then it is recommended to be on a high fiber diet. And if you still struggle with this, go to my diverticulitis video. Just go under playlist and you'll see where things are sectioned off with systems and specific diagnoses, so you can narrow through, because I know I have a lot of videos. But go there and look at that if you need further explanation. But I always get the question, is it low fiber or high fiber? And that is the reasoning, okay? If they're not in a flare, you want them on a high fiber. If you are in a flare, you're treating them, we start with that clear liquid 24 to 48 hours within after they're on therapy. They're usually doing a little bit better, so you can implement low fiber, and then you continue to advance as we progress through. But that's when that is low fiber versus high fiber. Now back to what we're talking about. So here they're talking about the treatments. There are a few treatment options that you can utilize that are considered first-line therapy for diverticulitis, and the only one that is incorrect is D-clarithromycin. For diverticulitis, you can use the combination of Flagyl and a fluoroquinolone like ciprofloxacin. So A is correct. You can utilize Flagyl and Bactrim. So metronidazole is the generic name, right? So you can Flagyl. So C is also correct. So you can either do Flagyl and ciprofloxacin or Flagyl and Bactrim as combination meds, given both for the treatment, or you can give them Augmentin B, right? So all three of those correct. Clarithromycin we do not utilize for the treatment of diverticulitis. So D is the answer, as this is the one that's incorrect. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Make sure you meet me back here. If you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number 1 at gmail.com. Now, the things that I do offer are my review book. You can get it in an ebook option or paperback. The ebook option, of course, once purchased, you have immediate access on any of your devices. These are both linked in the bio of this channel. If you are someone who prefers to study independently, I do offer a self-paced review course for family and adult GERO reviewers preparing for the ANCC as well as AAMP. That's also linked in the bio of this channel. If you are looking to utilize any of the QBank options, they're all linked in the bio of this channel. And then lastly, the reason why I say you can give us a call, shoot us an email or text is for those one-on-one sessions, because they're all customized and I prefer to speak with you to gauge what you truly need so that we can determine which one is the best fit for you for the one-on-one options. So if you need any of those things, feel free to reach out, but y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.